My name is Jean Kagubare. I'm the Deputy Director for Global Primary Healthcare Systems at the Bill and Melinda Gates Foundation. I'm originally from Rwanda, and I'm a medical doctor, but also have a PhD in health economics. I worked for 10 years here in this country, in Rwanda, before moving to the States, where I joined different organizations, and the last is being the Bill and Melinda Gates Foundation. The Bill and Melinda Gates Foundation decided to invest in the learning for actions for the health systems simply because we know that countries with the same socioeconomic status do perform differently, and we know there's an opportunity there to bridge the gap of the knowledge but also the practice. So the intent is really to help provide a platform which will provide support to countries and enable countries to actively exchange and continuously exchange the experiences in health reform, and also provide selected technical assistance to countries that needs to do reforms. This is a much needed platform because we could harness what exists in countries, but also with this modern age with communication and technology, I think we could be adding value to the body of knowledge. And we want to focus mainly in sub-Saharan Africa. And we know, for example, when you look at this country, Rwanda has performed very well in terms of health reform, particularly health financing. There are quite good innovative programs and activity that country can learn from each other. And I've had the privilege to work here, and then actually was part of the team that was involved in some of the major health reforms in the country. You may recall that after the war and the genocide, the system in Rwanda was in shambles, and it has to be rebuilt from the scratch. And I think back then the leadership of the country in the ministry decided to pilot and the scaling up of the community-based health insurance, or mutuals. This is a scheme that has been able to cover almost 90% of the rural population in the informal sector. Many countries are struggling how to cover the informal sector, the people who don't have a steady income. And yet here, this country, they have succeeded to incentivize the population to prepay before they get sick. This is the first. The second is the performance-based financing, which is a program that also was, I would say, pioneered in Rwanda, piloted and then scaled to the national level. That pushes the system to provide quality services to the population. This is a breakthrough at the international level, so to speak, and I think country would certainly benefit to learn the experience, how do you design, how do you implement, and certainly how do you sustain this type of scheme.